Now let's get into the PPO plans offered by the University of California. We have fewer PPOs this year, but we still have quite a few to get through, both non-Medicare and Medicare PPOs. So preferred provider organizations, that's what PPO stands for. It's insurance. No providers are prepaid to treat you. Instead, you choose any provider, but if you use a preferred provider, you have a much better level of coverage than you do if you use a provider who is not preferred. Now, a preferred provider is one that actually has a contract with your plan. That contract protects you from balance billing. Balance billing is when you're stuck paying the difference between a provider's charge and what the insurance company allows. Balance billing can cost you a lot of money. You always want to use preferred providers in order to avoid balance billing, because the contract between the provider and the insurance company limits their charges, and that protects you and it protects the plan. So using out-of-network providers is pretty much like setting money on fire. You really want to use preferred providers whenever you can. Now, a nice thing about PPOs is that nobody's prepaid to take care of you, so you're not limited to a handful of prepaid doctors, and you also don't have to get authorized referrals to see doctors when you're in a PPO. You can go straight to specialists if you want. Now, some specialists won't see you without a referral from another doctor, because that's how they weed out people who self-diagnose on the internet and waste their time. But the referral doesn't have to be authorized. It just needs to be a note from another doctor. PPOs have out-of-network benefits if minimal. HMOs don't have out-of-network benefits, but PPOs do. But before you get too excited about it, you obviously beware balance billing, which I just warned you about. But what I also need to warn you about is that, especially with the non-Medicare PPOs, the out-of-network coverage is even worse than it sounds. And I'll explain how later as we go through the presentation. With PPO plans, you have a lot more freedom because you're not beholden to one medical group. You can choose the medical care that's most appropriate for your future medical need because you're not tied to a geography or a medical group. But PPOs are definitely far more costly to use than HMOs are, unless you have Medicare. As you'll see with our Medicare PPOs, you can go to any Medicare provider. You don't have to worry about who's a PPO provider. And your costs are far lower, more on par with an HMO. But for our non-Medicare PPOs, with freedom comes financial risk. Now, when you're in a PPO, you generally don't pay when you go to the doctor up front. You pay later after you get billed by the doctor's office. Now, you should not be paying medical bills unless you've referenced your explanation of benefits. The explanation of benefits is the statement that your medical plan sends to you, either in paper or on paper or electronically. They're going to send you a statement that tells you how they handled the claim, how much was charged, how much they knocked off the top if you used a preferred provider because of the contract rate, how much they pay, and importantly, how much you pay. If you pay a medical bill without referencing your explanation of benefits, there's a good chance you might be overpaying, so I recommend against it. If you get a medical bill and you have not received an explanation of benefits, check to see if you've gotten one. That might be easiest by signing into your medical plan's website. Now, when you have a PPO, you have insurance, and you have to meet a deductible. Then you have to pay co-insurance up to an out-of-pocket maximum. So you're going to see these steps 1, 2, 3 as we talk about some of these PPO plans. Step 1, you are responsible for 100% of your costs while you're in your deductible period. So until you've met the deductible, you're paying 100% for everything except maybe preventive care until you meet that deductible. If you meet the deductible, then you're at level 2 where you're paying co-insurance. When you're paying co-insurance, you're paying a smaller percentage, maybe 30%, maybe 20%, maybe 4%. We'll talk about that depending on the plan. And you keep paying co-insurance, a percentage of the fees, until you reach the out-of-pocket maximum. If you have enough expenses to reach the out-of-pocket maximum, which includes what you've paid toward the deductible and in coinsurance, then you start paying zero and the plan starts paying 100%. Okay? So you pay the deductible, then you're down to paying a percentage until you meet the out-of-pocket maximum, and then you're done paying for the rest of the year, and then everything resets on January 1st. Let's take a look at our PPOs through the University of California. First up, the non-Medicare PPOs, the new HealthSavings Plus plan and UC Care. Remember, they are being administered by the new vendor Blue Shield of California. Of course, we've had Blue Shield before. We've flipped and flopped back and forth between Blue Cross and Blue Shield over the years. But this means that Blue Shield is going to be paying the claims and will be using the Blue Shield Preferred Provider Network. Now, our Medicare PPOs remain through Anthem Blue Cross. That's the UC High Option Plan and the UC Medicare PPO with and without prescription drugs. Those are Anthem Blue Cross plans, but with a Medicare PPO, you can go to any Medicare provider and you go to medicare.gov to find providers rather than anthem.com. Lastly, we have the UC Medicare Choice Medicare Advantage PPO that we will talk about in more detail. It's through United Healthcare. Again, you can go to any Medicare provider. You don't have to use United Healthcare providers with that plan either. Now, if you want to learn more about these plans, I have for you the websites to go to, which aren't necessarily obvious. So here you go. For the HealthSavings Plus and UC Care plans, you go to uchealthplans.com. And when you get there, you choose the employee medical plans, even if you're a retiree, because that means non-Medicare. If you are looking for information about the high option or UC Medicare PPOs, you also go to uchealthplans.com, but you indicate Medicare PPOs instead of non-Medicare employee plans. Then lastly, the UC Medicare Choice through United Healthcare. Go to the UC specific site, retiree.uhc.com/UC. And of course, UHC stands for United Healthcare. So let's talk about this PPO network change as we go from Anthem Blue Cross non-Medicare PPOs to Blue Shield of California non-Medicare PPOs. Remember, Core and UC Health Savings Plan are being replaced by Health Savings Plus, and UC Care and Health Savings Plus are both going to be administered by Blue Shield. So we're going from one network to another in California. Here's what I mean by that. In California, Blue Cross and Blue Shield are separate companies. And Blue Shield actually offers more preferred providers than Anthem Blue Cross does. In fact, there is a 97.7% provider overlap as we go from Blue Cross to Blue Shield for these non-Medicare PPO plans. That means it's very unlikely that you're going to lose a provider as we go from one network to the other. We are being assured that all the major providers are essentially the same in both networks. So if we're talking about big hospital systems, it's probably going to be the same. Any discrepancy is going to be probably smaller, more individual providers, individual practitioners, or smaller practices. Now, if you are outside California, it's completely different. There is literally no change to the PPO network outside California because Blue Cross, Anthem Blue Cross, and Blue Shield of California, they both belong to the Blue Cross Blue Shield Association of America, which is the PPO network outside California, but inside the United States. They also have a network outside the United States that we'll talk about in a bit. So there's no change to the network if you're outside California, just inside California. Now, let's say you're unlucky and you're starting to get letters saying that your current provider under Blue Cross is not a Blue Shield provider. If you're in the middle of a course of treatment that's going to go into 2026, then you're going to want to request transition assistance of Blue Shield. As soon as you get your Blue Shield ID card, you should call them and let them know. Transition assistance is when a new insurance company will essentially waive prior authorization requirements and may let you stay with the current provider if you've had no choice about the transition. Now, if you chose to go from, say, Kaiser to Blue Shield, no, you're not going to have transition assistance. That was your choice. But those of you who are in the core plan or the UC Health Savings plan, you might need to request transition assistance if your provider is not going to be part of the new network under Blue Shield, and especially if you're in the middle of a course of treatment. Now let's get to know the new Health Savings Plus plan for 2026. Remember, this plan replaces core and the UC Health Savings plan and is essentially a hybrid of the two. Now, Blue Shield is the PPO network. Blue Shield pays the claims, but as with our previous non-Medicare PPO plans, it isn't Blue Shield who's going to be answering the phones. It's going to be Accolade. Accolade healthcare advocates will be answering calls, not Blue Shield, and they offer clinical support and second opinions and things that a regular medical plan doesn't normally do. So they're kind of a hybrid of customer service and clinical support. They also offer virtual medical and psychology care through Accolade Care virtual visits, which we'll talk about. Now, this plan, Health Savings Plus, is a low premium, high deductible PPO designed to be compatible, according to IRS rules, with an HSA, a health savings account. So this is the first time I have been able to offer retirees a plan that's compatible with HSAs. So you cannot choose this plan mid-year, but if you choose this plan during open enrollment and you and none of your covered family members have Medicare, then you can have this plan for the following year. Now, a health savings account is very interesting. We're going to talk about it, but I want you to know that the HSA is partially funded by UC. So this health savings account will have money in it deposited by UC, but of course, you can also put money in the HSA on a pre-tax basis. Now, you would use the Health Equity website to transfer money to your HSA because Health Equity, think of them as the Fidelity investments of the HSA money. You would use their website to transfer money from a checking or savings account to the HSA. Now, you might be saying, but Garen, it's after tax if I transfer money from my checking account. Yes, it is, except that at the end of the year, Health Equity will issue a tax statement that makes everything you put into the HSA pre-tax. Okay? Then you can use the HSA money to pay for medical expenses. And you can either pay with an HSA smart card issued by Health Equity, or you can use the Health Equity website to pay providers, or you can use your Costco credit card and get your 1% cash back on that $1,400 MRI, and then use the HSA, the Health Equity website, to reimburse yourself from your HSA. So there are multiple ways to do it. Before we get into more detail about the coverage of the Health Savings Plus plan, let's spend a little more time on this HSA. Now remember, you can't contribute to an HSA if you or any covered family members have Medicare. So if you are a retiree and anybody in your family has Medicare, you're going to want to tune this out. This is YouTube. Feel free to skip forward or play double speed or whatever, because this is not for you. But if you don't have Medicare and you want to put away money on a pre-tax basis, pay attention. Now, I said that UC is going to put money into your HSA. They're going to do that every January. They're going to put $750 in your HSA if you're covering just yourself. They're going to put $1,500 in if you're covering yourself plus anybody else. So self plus anybody else is family coverage, and you get $1,500 into your HSA. But you too can contribute. And you might want to because HSAs have a triple federal tax advantage that really isn't available in other ways. You pay no federal tax on contributions, on earnings on those contributions and UC's contributions. And if you take the money out, if you withdraw it for eligible healthcare reasons, then you have no federal tax on withdrawals. So no taxes on contributions, earnings, or withdrawals for eligible healthcare expenses. Although California does tax contributions and earnings, this is a great way to avoid federal tax. And a lot of people save up their HSA money so that they can use it to pay their Medicare premiums someday when they do have Medicare. Just a thought. Now in 2026, you'll be able to contribute pre-tax up to $4,400 if you're a single person, add $1,000 to that if you're over age 55. If you're covering anybody else and you have family coverage, then you can put away up to $8,750 plus the $1,000 if you're over age 55. So you can put away several $1,000s. Just keep in mind that you need to subtract what UC put into the HSA when you contribute. You can't contribute $8,750 plus $1,000 if you're over age 55 and $1,500, have UC contribute $1,500. You have to subtract the $1,500 from your $9,750 that you would otherwise be able to contribute. So UC's contribution counts towards that limit. But as you can see, there are several $1,000s of taxes that you can avoid. Now, let's say you build up a balance in your HSA that is above $1,000. You can actually invest the money in mutual funds. And what's more, HSAs aren't just health savings accounts, they are retirement savings accounts, because if you turn 65 and you have money in your HSA, you can take out HSA money for any reason, and it's just taxed as normal income, like a distribution from your 403b or 401k or IRA. Of course, if you want that triple federal tax advantage, you're going to want to take that distribution for eligible healthcare expenses or to reimburse yourself for what you pay for Medicare. Now, if you're single and you're in this plan and you add a new family member, like you get married mid-year, UC is not going to add an additional contribution to your HSA until the following January. But you'd be able to increase the amount that you put in. And remember that this is an HSA, not an FSA. When you were an employee, you could have contributed to a health flexible spending account, an FSA. Health FSAs are not as flexible as HSAs, believe it or not. For example, HSAs are not use it or lose it. FSAs are. If you don't have eligible expenses to claim out your FSA money, you lose it. Not so with an HSA. An HSA is your own money. And you can increase, decrease, cancel, start up again. You can control your contributions to the HSA mid-year, which you cannot do with an FSA. Also, with an HSA, you can only spend the amount that's in your HSA. You can't spend above it. With an FSA, you make a pledge of, let's say, $2,000. You can spend the $2,000 from the get-go, even before you've paid in the full $2,000. Not so with the HSA. You can only spend what you have on account. So if you find out that you need to get have an expensive medical procedure come up, and you know you're going to need some more money in the HSA, you can transfer money from your checking account to the HSA and then use the HSA to pay for that care or reimburse yourself for that care. And then at the end of the tax year, Health Equity will issue a tax statement that makes whatever you put in there pre-tax. Now that you're probably tired of hearing me say HSA, let's talk about the coverage under the Health Savings Plus plan through Blue Shield. First of all, you have in-network and out-of-network benefits because this is a PPO. In-network means that you're using the Blue Shield network in California, the Blue Cross Blue Shield network outside California. And steps 1, 2, and 3, first you have to meet a deductible. If you're covering just yourself, your deductible is $2,500. If you're covering any dependents, you have a shared deductible of $5,000 between yourself and all covered dependents. Once you've met the deductible, if you have enough medical expenses, and of course you might have been spending HSA money towards the deductible, of course, But once you meet the deductible, you're down to paying 30% coinsurance. Blue Shield will start paying 70%, you'll pay 30%. Up to an out-of-pocket maximum of $6,700 if you're single, or $13,400 if you're covering anybody else. Now, keep in mind that preventive care is generally covered at 100%. So we're not talking about preventive care unless they find something wrong with you here. But for regular medical care and pharmacy, this is what it looks like. Now, I have this blue arrow that's pointing over to the out-of-network column. Out-of-network benefits are separate. You have a separate deductible. You have 50% coinsurance. You have an even higher out-of-pocket maximum. Plus, you're subject to the dreaded balanced billing. So going out-of-network is like setting money on fire. It's to be avoided. But the blue arrow means that what you spend in-network applies towards that out-of-network, out-of-pocket maximum. So if you're single and you've spent $5,000 towards your $6,700 in-network out-of-pocket maximum, and then you go to an out-of-network therapist or something like that, well, that's $5,000 applies towards the $8,000 out-of-pocket maximum under the out-of-network benefit. But again, you're going to want to avoid going out-of-network because of the extreme costs to you. There's no cost controls. Out-of-network providers have no contract with your plan, and they can charge whatever they want. You should be able to avoid it. Most medical providers are going to be in-network. You shouldn't need to go out-of-network for most medical care, almost always. I would understand if you used an out-of-network mental health provider, since so many mental health providers, behavioral health providers, have opted out of insurance. Here's another way to look at the self-only coverage simplified and so that we can call out the HSA. Again, this is self-only coverage we're talking about here. So step one, you got to meet that deductible of $2,500, assuming you're using preferred providers, Blue Shield providers. But don't forget that UC puts $750 into that HSA, and you can use that $750 towards your deductible. So you really don't have to pay the whole deductible yourself. But if you do meet the deductible, then you're down to paying 30% coinsurance. Again, if you put money in the HSA, you could be paying for that money out of your HSA on a pre-tax basis, up to an out-of-pocket maximum of $6,700. Past $6,700, Blue Shield is paying 100%, so you don't need to pay your own money. You don't need to use your own HSA money once you've hit the out-of-pocket maximum. Now, there are out-of-network benefits. I don't suggest that you use them, but it's a PPO, so you do have some out-of-network benefits. Now let's do the same kind of simplified table example, but this time for family coverage. So family with this type of plan means self plus anybody else. It could be self plus spouse plus 10 kids. It's all the same. If you're covering anybody else, you, number one, have a shared deductible of $5,000, which means that whether it's you or anybody else that you're covering that gets sick, one of you or all of you could spend money toward that deductible. But again, UC is putting $1,500 into the HSA, which you can use towards your deductible. And then the rest of the deductible and your 30% coinsurance thereafter could be paid for with HSA money on a pre-tax basis if you add money to the HSA. Then you pay 30% up to the family shared out-of-pocket maximum of $13,400. That's the point at which you stop paying and Blue Shield pays 100% for the rest of the year. And then, of course, everything resets on January 1st. Yes, there are out-of-network benefits, but we won't talk about them. With our non-Medicare PPO plans, Navitus is the pharmacy benefit manager, not Blue Shield. Remember, Navitus is this company owned by Costco. So Navitus controls the pharmacy benefits and tells the pharmacies what to charge you when you fill prescriptions. Now, the way the plan covers prescription drugs is the way it covers medical care. There are no flat copays. Instead, you have to meet a deductible, so you're paying 100% for your drugs while you're in your deductible period. And if you meet your deductible, Navitus will tell the pharmacy to charge you 30% up to that out-of-pocket maximum. So it's literally the same coverage for drugs as it is for medical care. Now, drug expenses do apply towards your deductible and out-of-pocket maximum. So anything you spend on medical care and drugs is helping you get closer to that out-of-pocket maximum protection. When it comes to mental health coverage, behavioral health coverage through the HealthSavings Plus plan, again, the benefit's the same as it is for medical and pharmacy. You have to meet the deductible, and then you have to pay 30%, etc. And here you want to make sure you're using Blue Shield PPO providers. You want to use in-network providers so that you're not stuck being balance billed and all that if you possibly can. Out-of-network providers just cost you a lot more. But here's another idea for you. Accolade. Accolade offers virtual visits they call Accolade Care. Mental health visits. You can get up to, I take it back. There's no 12 visit limit. You pay $30 per visit, 30% if you've met the deductible, 30% of 30, I assume you would pay $10 after you meet the deductible for virtual visits with Accolade behavioral health professionals. So the HealthSavings Plus plan has some advantages. First of all, a low monthly premium. In fact, one of the lowest premiums that you can get as a UC retiree. In fact, the lowest premium among non-Medicare plans. It also, when you compare it to the other PPO that is non-Medicare, UC Care, it has a lower out-of-pocket maximum. And that out-of-pocket maximum is shared by the whole family, so that whether it's you or 10 kids, you stop paying at some point, and Blue Shield starts paying 100%. Now, the plan offers a tax-advantaged HSA offered by no other plan that is partially funded by UC. You're getting free money from UC in your HSA with this plan. You can contribute additional amounts pre-tax. Unused HSA dollars roll indefinitely. It's your money, and you can use it for eligible healthcare expenses. You can use it as retirement money at age 65. But the idea here is that you're going to use that HSA to pay for your deductibles and other out-of-pocket costs, and then someday maybe use it to pay for your Medicare premiums or other healthcare expenses, even after you no longer have the plan when you get Medicare. HealthSavings Plus members have access to Accolade Care virtual visits for both medical and mental health. Now, for mental health, you got to be at least age 18, okay? But for medical and mental health, you have Accolade Care access at $30 for virtual visits until you meet the deductible, and then it's 30% of $30, I believe $10 after that. And this is a PPO plan, so you have access to the large national provider network, huge network in California, and you actually have international coverage with this plan. Blue Shield belongs to the Blue Cross Blue Shield Association of America. They actually have preferred providers in something like 190 countries around the world that you could use, some of whom can actually bill U.S. insurance. So it has its advantages. It also has its limitations. I mean, first of all, it offers an HSA, which is great, but an HSA, that's an additional complication. For example, HSAs make the plan incompatible with Medicare Parts A and B and any other coverage that is not also an IRS HSA qualified high deductible health plan. Okay, that means that as soon as you get Medicare, you or a covered family member, you're going to have to change medical plans. Of course, Nick Robledo and I will help you with that when the time comes. Just give us a call. Call us 3 months before you turn 65. Okay. Now, you can be double covered with this kind of plan. I personally am double covered by 2 high deductible HSA compatible medical plans. That's okay. You just can't have this plan and another plan that isn't an HSA qualified plan. And that includes Medicare. The plan does have a high deductible and out-of-pocket limit per person or per family, however you look at it. this plan is way more expensive to use than is an HMO. It's also not offered mid-year. The only way you can get into this plan as a retiree is through an open enrollment election. You may want to consult a financial advisor before choosing this plan just because of the additional complication of the HSA. But in my mind, a financial advisor's eyes will probably light up with joy if you tell them that you're considering a health plan with an HSA because of all the tax savings. At least it's that way in my mind. You have some limitations on acupuncture and chiropractic. You're limited to 24 visits combined between acupuncture and chiropractic, as all the plans do. And you do have out-of-network coverage, but it is severely limited, and you would be subject to balance billing as well. So remember when I said that the out-of-network coverage is worse than it even looks? Well, here's an example. If you have the HealthSavings Plus plan and you use an out-of-network surgery center, the plan will pay 50% of only $210. Do you think $105 is going to offset much of your surgery costs? I don't. Look at the hospital coverage. Out-of-network hospital coverage is limited to 50% of $360 a day. I mean, this is essentially coverage in name only. It is coverage, but it is very, very weak. HSAs are incompatible with health FSAs, which means this plan is incompatible with health FSAs. So make sure that if you retired recently and you were contributing to the health FSA as an active employee, you want to make sure that you zero out that FSA balance by December 31st of the previous year so that you don't have your life complicated by weird rollover amounts from a health FSA that would have to go to a standalone FSA. You don't want to deal with all that. Zero out your health FSA. And lastly, I will say that because of the HSA, you're going to want to save all of your eligible healthcare receipts for anything you use your HSA money for in case you're ever audited by the IRS. Our next non-Medicare PPO is UC Care. Again, if you're eligible for Medicare and your covered family members are eligible for Medicare, just skip ahead. UC Care, unlike the HealthSavings Plus plan, which is a high deductible, low premium plan, this is a high premium, low deductible PPO through Blue Shield. So it's not compatible with an HSA. It is like a standard PPO with two levels of in-network providers. So usually PPOs have an in-network and an out-of-network. UC Care has an in-network, an in-network, and an out-of-network. It has two in-networks. You can either use special UC Select providers and pay low flat copayments for most care, which is a small subset of Blue Shield PPO providers, or you can use the wider Blue Shield network and pay 30%. You wouldn't pay low copayments. You would pay towards the deductible, and then you would pay 30%. So this plan is a little bit more complicated when it comes to who you go to. Again, Accolade is answering the phone, not Blue Shield with this plan. So you have access to virtual medical and psychology care through Accolade, and also some of the clinical support that they offer, as well as their customer service and assistance with claims. Let's focus on Blue Shield's Tier 2 and Tier 3 coverage first. Remember, there are two in-networks. So Tier 1 and Tier 2 are both in-network, and then Tier 3 is out-of-network. Here, let's focus on Tier 2, which is a standard Blue Shield PPO provider. This would be a provider in the Davis or Sacramento area like Sutter, like Mercy, like Hill Physicians, UCSF, Stanford, Mayo Clinic, MD Anderson, etc. When you use regular Blue Shield PPO providers, you're going to have to meet first a $500 deductible if you're single. It's per person per year, with a maximum deductible of $1,000 for a family of 3 or more. Then you got to meet 30% coinsurance. You have to pay 30% coinsurance up to the highest out-of-pocket maximum across all UC medical plans $7,600 per person per year, or $14,200 per family. So this plan can be very expensive to use. Now, I'm focusing on Tier 2 here. We'll talk about the Tier 1 UC Select network next, but this is what you should be looking at if you live in rural California, where there are no Tier 1 providers. Tier 1 providers are near UC campuses. If you're up at Chico or Eureka or someplace, or you're out of state, you're looking at this kind of coverage with Blue Shield providers with this plan. It can be very expensive to use. There are out-of-network benefits. Of course, they are inferior and involve subjecting you to tons of balance billing, so I wouldn't recommend it. Now let's focus on that Tier 1. When you're using that subset of Blue Shield PPO providers known as UC Select. Of course, UC Select means all UC medical centers, but it also means certain other providers located near UC campuses. UC Select means near UC campuses. If you're not near a UC campus, you're unlikely to find any Select providers. So choose this plan carefully. Now, if you are able to use UC Select providers, understand that you'll get a lot of services for flat dollar copayments, almost as if you're in an HMO, even though you are not. For example, you would have a flat dollar copayment of $30 for physician office visits, whether it's your PCP or a specialist. As long as they're UC Select, flat dollar copay. Urgent care centers, $30. ER, $300. These aren't just for UC Select providers, because you may not be able to choose where you're going if it's urgent or emergent, but you have flat dollar copays for those services. Ambulance is $200. Outpatient surgery, $100. $250 is the inpatient hospital copay, as long as you're using a UC medical center like UC Davis, UCSF, UCLA, UC Irvine, UC San Diego. You get the drift. So flat dollar copayments. Now I got to warn you, the way this plan is designed, it is not an HMO, it's a PPO, and you can be line itemed on these copayments such that multiple copayments can apply per service. For example, let's say you go to a UC Select provider and you get an MRI. You might have to pay $30 for that MRI plus $30 for the facility fee associated with that MRI plus $30 for the radiologist to read the MRI. You just spent $90 on that MRI, not $30. So don't be surprised when that happens. It's not an error, it is plan design. Here we have a simplified view of self-only coverage for UC Care. First, you have to meet a deductible. Oh, no, you don't. Not if you use a UC Select provider. For most services, you'd have no deductible if you use a University of California provider or a certain Select provider near a UC campus. Instead, you just pay flat copayments with no deductible instead of coinsurance, flat copayments up to an out-of-pocket maximum of $6,100. But if you use regular Blue Shield preferred providers, like Sutter, like Stanford, you got to meet a $500 deductible, then you're paying 30% up to $7,600. The blue arrow signifies that what you spend towards UC Select providers does count towards your Blue Shield PPO Tier 2 $7,600 out-of-pocket maximum. Of course, beyond that, Blue Shield's going to cover you at 100%, assuming you get everything authorized and you use preferred providers for everything. Of course, there is an out-of-network benefit, but it's so expensive to use, we won't even talk about it. Unlike the HealthSavings Plus plan, UC Care has a flat dollar copayment pharmacy structure. So when you look at the drug benefits, you're looking at a $10 copay for generics, $30 for brand name, $50 for non-formulary, 30% up to $150 per script for specialty medications. This is a copayment structure very similar to HealthNet, but it's not an HMO. It's a PPO plan. Again, Navitus is the pharmacy benefit manager, and you can get 90-day supplies of your maintenance medication for 2 copayments if you use UC pharmacies or if you use Costco, CVS, Safeway, Vons, Walgreens, or Walmart, or if you use mail order through Costco. That's how you can get a 90-day supply for 2 copayments through UC Care. When it comes to mental health, behavioral health coverage through UC Care, it's a little different than the Health Savings Plus plan. Here we have copayments. In fact, the first 3 visits are, the copayments are waived to get you started, but then visits 4 and on will cost you $30 as long as you're using Blue Shield PPO mental health providers. Okay? Got to use preferred providers for the best level of benefit, because if you go to out-of-network providers, you're going to spend a lot more. The coverage won't be as good, and you'd have to watch out for balanced billing. Another idea might be to use Accolade Care. You have 12 no-cost Accolade Care virtual mental health visits if you're at least age 18 with UC Care. So UC Care has its advantages. You have low copayments for care from UC Select providers, network urgent care providers, and low copays for ambulance and ER, flat copays instead of paying 30%. You also have a low deductible for PPO providers compared to the Health Savings Plus plan. In addition, low copayments for mental health, emergencies, and pharmacy compared to the Health Savings Plus plan. Now, it's a PPO, so you have the advantages of PPOs and that you have access to tons more providers than you would with an HMO. You don't have to have a PCP. You should. Primary care physicians charge less than specialists, but you don't have to pre-designate a PCP, and you can self-refer to medical providers who will allow it. You have access to a large preferred provider network, and you do have out-of-network coverage, if minimal. You also have comprehensive coverage outside the United States. You're actually covered at 80%, not 70%, when you are outside the United States after you meet the Blue Shield PPO deductible, which is nice. Now remember, there are preferred providers outside the United States. You're not required to use them, but if you can, some of them can bill U.S. insurance. And if you want to search for these providers, you can do so on the UC Davis Healthcare Facilitator Program website. From there, you can launch to searches for preferred providers for all the plans. Another advantage of UC Care is Accolade Care virtual visits. You have 12 no-cost medical and 12 no-cost mental health visits if you're 18 or older each calendar year with Accolade Care online. This plan has some significant downsides. First of all, it is a complicated PPO with its 2 levels of in-network. Be aware, some services are not available at the UC Select level of coverage. Even if you use a UC Select provider, if you get services like skilled nursing, very expensive, infusions, very expensive, durable medical equipment can be very expensive. There is no low copay benefit for those things. You are paying 30% even with UC Select providers for certain services. So choosing UC Care, you may expect to use UC Select for everything, but it can go sideways on you if you need skilled nursing, durable medical equipment, or infusions. And not all provider types are available as UC Select, and there may not even be Select providers near you. You have to be near a UC campus to find a UC Select provider. So if you're in a rural area or you're outside California, you're going to be in the Blue Shield PPO Tier 2 column, okay? Watch out for multiple copayments applying per service with the UC Select tier. That can happen. There are some limitations on acupuncture and chiropractic, 24 visits combined, and out-of-network coverage is severely limited. Not only would you be subject to balanced billing, it would be balanced billing on top of the tiny amounts that this plan will pay. For example, for surgery centers that are out of network, you go to an out of network surgery center, you have 50% coverage, 50% of $175. That is very little money towards your surgery. An outpatient hospital, 50% of $300 a day is $150 a day. That's barely scratching the surface of any hospital charge. So you're going to want to avoid that out-of-network coverage that you have. And of course, even though it's a PPO, you are subject to pre-authorization for imaging, really anything expensive with the Health Savings Plus plan and this plan. I want to make sure you understand that prior authorization is required, even if you don't need referrals to see doctors per the insurance company. But the biggest caution I have for you is that this plan, UC Care, has not just the highest premiums of all UC medical plans, it also has the highest financial risks of all UC medical plans. If you choose UC Care, you could, if you're unlucky or you use the wrong providers, if you choose UC Care, you could be paying more for the privilege of paying more. Now remember, if you have UC Care and you're covering any family members that have Medicare, the Medicare partner plan is UC Medicare PPO. So if you're in a mixed Medicare family, you could literally have family members with Blue Shield and family members with Blue Cross at the same time. And if you yourself are going to turn 65 next year and you have UC Care, call us 3 months in advance of you turning 65 and we'll help you into the UC Medicare PPO, a fabulous plan that we'll be talking about in not too long. But before we get into the Medicare PPOs, I want to do a quick compare and contrast between these two non-Medicare PPOs through Blue Shield, Health Savings Plus versus Core. Now this is self-only coverage, and this is a best case scenario. So that's why you see one smiley face on this slide. It's a single person, best case scenario where they have no medical claims, they don't fill any prescription drugs, all they do is pay premium for the year. Well, if you're in the Health Savings Plus plan and you get 100% of the UC contribution, then you will have spent $3,500 on premium throughout the course of the year just to be in the plan, sick or not. Let's say you didn't have any medical expenses, you didn't fill any prescriptions, you didn't use the plan. Were you really out $3,514 if UC put $750 in your HSA? Well, not really. I think of it as being out $2,764.32 for the year. Because of that HSA money you can use to pay for medical expenses, if not this year when you didn't have any, in some future year. Contrast that with UC Care. UC Care is going to cost you $4736.40 to be in the plan, sick or not, over the course of 12 months. So the two plans have divergent premiums, if you will. Now let's do a similar comparison, but this time with high claims. Notice that the single smiley face is frowning now. It's not a smiley face, it's a sad face, because this time, in this example, the self-only coverage is for somebody who hit their out-of-pocket maximum. Now, if you're in the if you're in the Health Savings Plus plan, you're going to spend that $3514.32 to be in the plan, sick or not. That's your premium. But if you hit the out-of-pocket maximum, that's $6,700, which means you could spend $10,214 if you're unhealthy or unlucky in this plan. But you really wouldn't spend the full $10,214 yourself because UC put money in there on a pre-tax basis, $750 off your $10,200. So really your out-of-pocket is $9,464.32, much of which you could have paid pre-tax if you transferred money into your HSA from your checking account using the Health Equity website. The other example is UC Care. UC Care again is going to cost you $47.36.40 over 12 months to be in the plan. That's the premium. Let's say you hit the out-of-pocket maximum with UC Care, $7,600. Now you might say, but Garen, I'm going to use UC Select providers for everything. I appreciate that, but this is a worst case scenario of high claims where some of your claims you couldn't get at the UC Select level of benefit. Let's say you had a hip replacement for $250 at UC Davis Medical Center, but then you were released to a skilled nursing facility which you can't get skilled nursing facility covered at the UC Select level of benefit. You're paying 30%, and skilled nursing is not cheap. So let's assume that even though you tried, you were not able to do everything for low copayments under the UC Select level of benefit. Or let's say you live in a rural area where there aren't any UC Select providers, or you live outside California or outside the United States, and you hit the $7,600 out-of-pocket maximum. That brings your total outlay to $12,336.40. Now we're back to smiley faces, this time 2 smiley faces, because we're looking at a PPO best case scenario with no medical claims for 2 people. Here we have self plus spouse coverage, and we'll compare the 2 plans. If you're covering a spouse with the HealthSavings plan, your premium over the course of the year, assuming you get 100% of the UC contribution, $8,148.96. That's what you'll spend to be in the plan, sick or not. Let's assume you didn't have any medical claims and you didn't buy any prescription drugs or anything. 0 claims. Well, you spent $8,148.96 on premium, but UC put $1,500 in your HSA, so you could think of it as being only out of pocket $6,648.96 because you pocketed $1,500 that you could use for healthcare expenses in some future year. At least that's how I kind of feel about it. Compare that with UC Care. With UC Care, you got a $10,715.28 premium for 2 people over the course of the year. And that's what you spent to be in the plan, even if you didn't use it. So now let's look at a worst case scenario for 2 people. Here again, the smiley faces are frowning, and there are 2 of them because we're covering 2 people here. Self plus spouse coverage under the HealthSavings Plus plan, again, is going to cost you the same $8148.96. But in this case, you had a bad health year. You and or your spouse, either one of you, because remember, it's a shared deductible, shared out-of-pocket maximum. You hit your out-of-pocket maximum of $13,400 for a total outlay of $21,548.96. Oh my goodness. But you really weren't out that much. You were out $20,048 if you take into consideration the $1,500 that UC put into the HSA that you could use towards your deductible and out-of-pocket maximum. So really you're out $20,000. Under UC Care, your worst case scenario is if both you and your spouse both have a bad health year, and you both hit the $7,600 out-of-pocket maximum. Again, this is a worst case scenario. Maybe you'd never spend this much because you live in an urban area near a UC campus where you can go to UC providers. UC Select providers cost you low flat co-payments, and so you would never spend this. But this is a worst case scenario where you needed skilled nursing, maybe infusions, maybe durable medical equipment, or you just weren't near a UC Select provider. Whatever it is, you hit the out-of-pocket maximum, and so did your spouse. Your total outlay is just under $25,000 with the UC Care plan. Next up, we'll talk about the Medicare PPOs. UC offers 3 Medicare PPO plans to retirees. 2 of them are Medicare supplement plans. One's a Medicare Advantage plan. First up, we're going to talk about the Medicare supplement plan, UC Medicare PPO. Only one of them is titled UC Medicare PPO, and that's this one. With the UC Medicare PPO plan, which is a Medicare supplement where we have Medicare paying first and Anthem paying second, you can go to any Medicare provider and you can look for providers on Medicare.gov. Medicare pays first. Medicare pays 80% or better for medical care. The 20% or less that's left over then goes to Anthem. Anthem will automatically electronically pay 80% of whatever's left. That means that you're paying 4% of the medical care. If it's covered by Medicare, you're paying 4% of the Medicare allowable charge. And that's because you're paying 20% of the 20% that Medicare didn't pay. Remember, Anthem pays 80% of the 20% Medicare didn't pay. You pay 20%. 20% of 20% is 4% or less. Now, if you get service that's not covered by Medicare, you do have a $100 deductible, and then you pay 20%. But we'll talk more about that in a minute. Anthem Blue Cross members have access to Live Health Online virtual medical and psychology care for $20. So not only can you go to any Medicare provider, but you can see providers through Live Health Online for a low $20 copay. Now, I've got to warn you, Medicare recently stopped covering a lot of telemedicine. So that's why I want to be sure to point out this Live Health Online. You can still get telemedicine for mental health through Medicare, but starting October 1st, a lot of other things are not available through telemedicine through Medicare, sadly. So let's break down the coverage into services that Medicare covers, which is most services, and then services not covered by Medicare, but are covered by the plan. We call the extra benefits that we pay Anthem to cover things that Medicare doesn't cover. We call these things benefits beyond Medicare. So on the left, Medicare covered services, your average normal medical care. First, there's a deductible under Medicare, but Anthem pays it for you. So you don't have to meet the deductible yourself. You don't have a deductible for Medicare covered services. Instead, you're paying that 4% that I described before, up to the out-of-pocket maximum of $1,500 per person per year. Nice low out-of-pocket maximum. Now, if you get services that are not covered by Medicare but are covered by the plan, these benefits beyond Medicare that I described, something like hearing aids, if you use a Blue Cross provider, you'd have a $100 deductible to meet, and then you're paying 20% up to the same out-of-pocket maximum of $1,500. That's why there's a double-headed arrow here. It's the same $1,500 whether you go, whether we're talking about Medicare covered services or benefits beyond Medicare that are covered by the plan. Don't get me wrong. If Medicare doesn't cover something and it's not a benefit beyond Medicare, it's not covered, period. But if it is a benefit beyond Medicare, you're not going to spend more than $1,500 all year between Medicare covered and benefits beyond Medicare services. Keep in mind that $1,500 does not include prescription drug co-payments. Those are Medicare Part D and have their own separate out-of-pocket maximum that we'll talk about in a bit. Let's look at the UC Medicare PPO coverage in a different way, and I really want to focus on the benefits beyond Medicare that I talked about before. Remember that for regular medical care that Medicare covers, original Medicare Parts A and B, that's your primary insurance. UC Medicare PPO pays second, you pay third if anything, and you have to use Medicare provider. But there are exceptions for benefits beyond Medicare. Now, benefits beyond Medicare include things that Medicare does not cover, but we specifically pay Anthem Blue Cross to cover. Those things include, among other things, acupuncture, hearing aids, marriage and family therapists, non-Medicare mental health providers. Medicare doesn't pay non-Medicare providers usually. And services outside the United States. Medicare doesn't pay outside the United States. For all these benefits, it's Anthem Blue Cross who's paying the claims. And Anthem is going to apply a deductible. If it's not covered by Medicare, but it's covered by the plan, first you have to meet a small $100 deductible. Then you have to pay 20% coinsurance up to the out-of-pocket maximum of $1,500. That includes services from Medicare and benefits beyond Medicare. What I'm saying is that with this plan, you could literally get a $9,000 pair of hearing aids from a Blue Cross hearing aid dispenser, and you could fall down the stairs in Paris and get weeks of physical therapy before coming back to the United States, before having a kidney transplant, and the most you'd pay all year is $1,500 plus copayments for drugs. Speaking of copayments for drugs, we have a 3-tier pharmacy copayment structure here where you pay $15, $35, or $50 depending on the drug for a 30-day supply of drugs. And you can get 90-day supplies for 2 co-payments at UC pharmacies, Costco, CVS, Safeway, or Vons, Walgreens, Walmart, or you can use Costco mail order. Remember, Navitus is the pharmacy benefit manager, and you'll have a separate Navitus ID card to carry around that says Medicare RX on it. That tells the pharmacy that you have Medicare Part D through Navitus. So UC Medicare PPO members have 3 ID cards to carry around: the Medicare card, the Anthem Blue Cross Medicare PPO supplemental card, and the Navitus Medicare RX card. Now, some medications do require prior authorization like any other drug plan, but the out-of-pocket maximum is $2,100 in 2026. That out-of-pocket maximum includes what you spend on copays for drugs, as well as what the plan spends on copayments for drugs. So you could literally get very, very expensive medications. Like, let's say you're getting $5,000 prescriptions. You might only have a couple of copayments to pay all year if the plan is spending thousands on your medication, because between your copayments and the plan spending money on drugs, combined, the out-of-pocket maximum of $2,100 could kick in, leaving you to pay no more copayments for the rest of the year. So don't be surprised if you take expensive specialty medications and you stop paying for drugs before you thought you might. There are select generics that might cost you nothing. And something you need to understand about this coverage is that when you're getting diabetic supplies, if you have diabetes, tune in here. When you're getting diabetic supplies through this coverage, you must use Medicare Part B first and then Navitus second at the pharmacy. So sometimes pharmacies find that awkward. You might have to call Navitus and have them call the pharmacy and tell them how to do it. But long story short, if you don't want to pay for your diabetic supplies, you get Medicare Part B to pay first and then Navitus second. Under the UC Medicare PPO. It shouldn't surprise you that you should be using Medicare providers for better coverage, because Medicare is primary for the UC Medicare PPO. But if you can't find a Medicare mental health provider and you use an Anthem preferred provider, that's your second best bet. If you can't find a Medicare provider, use an Anthem preferred provider, and then you're paying 20% after the $100 deductible. If you use a mental health provider that is neither a Medicare provider nor an Anthem preferred provider, you are still covered due to the benefits beyond Medicare. But beware, if you're using a non-Anthem provider who is opted out of Medicare, you're looking at paying that 20% benefit beyond Medicare coinsurance, plus you'll be balance billed. So ideally use the Medicare providers. Second best is going to be Anthem preferred. Now, if you use non-Medicare providers, Anthem is going to need a letter proving that the provider has opted out of Medicare, because Anthem can't tell otherwise. Anthem doesn't know who's opted out of Medicare. So you need to get a letter from the provider showing that they have opted out of Medicare. Not that they don't take Medicare, that they have opted out of Medicare. Submit that once a year along with your reimbursement claims for the provider, and then your claim should go through. Now, an exception is for marriage and family therapists. You don't need the opt-out letter for them because Medicare doesn't cover marriage and family therapists. Okay? Now, hopefully you found a provider who will actually bill Blue Cross for you. But even if you do, Anthem's going to need that letter if they are opt-out providers. UC Medicare PPO has several things going for it. First of all, it has the lowest monthly premium of all the Medicare PPO plans in 2026. Yes, it is cheaper than the Medicare Advantage PPO for the first time. That has changed for 2026. It also is an advantage to have Medicare as your primary insurance, because then your doctors don't have to get prior authorization for everything. You can use any Medicare provider for Medicare covered services or any licensed provider for behavioral health services. You have low 4% coinsurance that stops at $1,500 anyway. I mean, you might be thinking 4% of $1 million, that's a lot of money. No, it's not when you stop paying at $1,500. You have comprehensive coverage outside the United States for up to 6 months with this plan. Medicare does not pay outside the US, so this is one of the benefits beyond Medicare that we pay Anthem to provide. It's not just emergency only. We're talking comprehensive coverage. Now, Blue Cross belongs to the Blue Cross Blue Shield Association. They do have a network of preferred providers in something like 190 countries around the world. Some of those providers can actually bill US insurance. So you might want to try to use preferred providers if you can, even though you're not required to. The Medicare PPO includes acupuncture coverage that Medicare doesn't provide through those benefits beyond Medicare, and hearing aid coverage at 80% with no arbitrary cap. This is the nicest hearing aid coverage that we've seen so far. Plus, even though Medicare won't cover a lot of telemedicine as of October 2025, you have access to live health online, telemedicine, and telepsychology for $20. There are some limits of the plan. First of all, the benefits beyond Medicare do not include telemedicine not covered by Medicare. Now, I told you about the coverage through Live Health Online, but Live Health Online isn't going to solve certain problems. For example, I've had somebody tell me that they had been scheduled for a telemedicine appointment for their pre-op appointment before their surgery. When Medicare canceled telemedicine starting 10/1, suddenly they had to drive downtown for their pre-op appointment that did not need to be done in person, sadly. So be aware that the benefits beyond Medicare do not make up for the Medicare shortfall in, new shortfall in telemedicine coverage. There are some limitations on acupuncture that you will have heard from other plans too. It's very similar. You must use Medicare providers for non-behavioral health services. And when it comes to diabetic supplies, it's awkward, but you've got to get your pharmacy to bill Medicare Part B first, Navitus second, in order for you to pay $0. Now, if you choose this plan, I want to warn you about something that's a little strange. In the Davis-Sacramento area, Sutter primary care physicians, that's PCPs, not specialists, PCPs, for something like 10 years or more, have not been accepting new Medicare patients. When Sutter started getting short on primary care physicians, the first people they cut off were Medicare patients. And I called them up and I asked them about this. And I was told that they stopped taking new Medicare patients because they were short on primary care physicians. And it's easy for them to stop taking new Medicare patients. And Medicare patients have access to more doctors than people with private insurance, so they're the least impacted. And when I asked them, well, why, Sutter, are you still taking why are your primary care physicians, I should say, still taking Medicare Advantage patients when you're not taking Medicare patients? And they said because it's really difficult to turn off access to Medicare Advantage patients for their primary care physicians. And the reason is they'd have to contract with each different Medicare Advantage plan, and there are lots and lots of Medicare Advantage plans. So be aware that if you want a new Sutter primary care physician, you might want to be in a Medicare Advantage plan to get that doctor. You could then switch to a Medicare supplement plan later during a future open enrollment. But at first, it's something to think about. If you are somebody who uses Sutter for primary care and you're a PCP, they might retire out from under you. I want to warn you about this limitation here. If you're in the UC Medicare PPO and you have a Sutter PCP who retires, you may not be able to get another Sutter PCP. You can still go to your Sutter specialist, but you might have to go to UC Davis or Woodland Clinic or Mercy Medical Group or Hill Physicians, some other primary care physicians, which might be a little awkward when you use Sutter specialists. So heads up. Next up is the UC High Option Plan, the other Medicare supplement plan through Anthem Blue Cross that UC offers. With High Option, Medicare pays first, Anthem pays the rest, you pay $0. That's how it generally works. It is a Medicare supplement plan where Medicare pays first. And if you're looking for Medicare providers, you just go to medicare.gov. For most services, the plan pays 100% of the balance after Medicare, leaving you to pay $0. Now, there is a $50 deductible and 20% coinsurance that applies to services that aren't covered by Medicare, but are covered by Blue Cross, like acupuncture. And as I mentioned with the UC Medicare PPO plan, you do have access to live health online telehealth for $20. But most medical care is covered by Medicare. And with this plan, if Medicare covers it, you pay zero most of the time. So again, we have original Medicare paying first, high option, Anthem Blue Cross paying second. So you must use Medicare providers. But again, there are those exceptions for benefits beyond Medicare, as we have with the UC Medicare PPO plan, where if you use benefits beyond Medicare, you do have to meet a deductible. If it's not covered by Medicare, but covered by the plan through benefits beyond Medicare, but the deductible is smaller, it's $50 instead of $100. Then you have 20% coinsurance up to a lower $1,050 out-of-pocket maximum. Now, those benefits beyond Medicare, as a reminder, include acupuncture, hearing aids, marriage and family therapists, non-Medicare mental health providers, and services outside the United States. And again, you want to use preferred providers through Anthem Blue Cross for your hearing aids and acupuncture and so on and so forth to keep your costs down and to avoid balance billing. But what I'm saying is that with this plan, you could literally get a $9,000 pair of hearing aids and fall down the stairs and get tons of physical therapy in France before coming back to the United States for your kidney transplant. And the most you would pay is $1,050, not $1,500, $1,050 plus copayments for drugs, which are low, as long as you got that hearing aid from a Blue Cross hearing aid dispenser. And as long as your kidney transplant was in the United States from Medicare providers and Medicare paid for it, you can see where I'm going with this. You're paying very little for care with this plan. When it comes to behavioral health benefits, mental health benefits under high option, again, if you use a Medicare psychologist or therapist or psychiatrist, Medicare pays first, Blue Cross pays the rest, you pay zero, no coinsurance if covered by Medicare. If you can't find a Medicare mental health provider, make sure you use an Anthem preferred provider so that you only pay 20% up to the out-of-pocket maximum. Because remember that if you use a non-Medicare, non-Anthem provider, you're looking at balance billing. Now, if you do use non-Medicare providers, similar to the UC Medicare PPO, Anthem will need a letter proving that that provider has opted out of Medicare because Anthem won't know otherwise. And for them to process the claim properly, you'll have to produce one of those letters a year, proving that the provider has opted out of Medicare. And remember, it's just behavioral health providers who have opted out of Medicare who would be covered by these plans. When it comes to prescription drug coverage through the UC High Option Plan, the coverage is almost identical to the UC Medicare PPO. Again, we have $15, $35, or $50 copayments. The 90-day supply for 2 copayments is through all the same methods. Everything is the same, including the diabetic supplies needing to be billed to Medicare by the pharmacy first and then Navitus second. The one difference is the out-of-pocket maximum. With the UC High Option Plan, your pharmacy expenses are limited to $1,000 worth of copayments. So if you take a lot of medications, your copayments might add up to $1,000. But even if they don't, if your copayments plus what the plan pays add up to the $2,100, that's the Medicare Part D out-of-pocket maximum behind the scenes, again, you might not even spend $1,000 on this under this plan on drugs, just because of the way the Medicare Part D drug benefit out-of-pocket maximum is calculated. So high option has some sweet advantages. Medicare's primary, so you rarely have to get prior authorization and you have maximum access to doctors, but you pay nothing for most medical services. If it's covered by Medicare, you pay zero for most medical services. You can use any Medicare provider or any licensed provider for behavioral health. You have comprehensive coverage outside the United States, same as the UC Medicare PPO plan, for up to 6 months outside the US. Try to use Blue Cross Blue Shield international providers if you can, but you're not required to. You have hearing aid coverage at 80% with no arbitrary maximum, same as the Medicare PPO. Acupuncture coverage, same as the Medicare PPO, but you also have the lowest prescription drug out-of-pocket maximum of all the Medicare plans at $1,000 if you take lots and lots of different prescription drugs. Now, the downfall of the UC High Option plan is that it has the highest monthly premium. So even though the coverage is better than the UC Medicare PPO, you are unlikely to save money by choosing this plan over the UC Medicare PPO because the premium is way, way higher for the UC High Option plan. For example, High Option for somebody who gets 100% of the UC contribution, it's $363 for a single person, $364 really, versus the UC Medicare PPO, the premium's only $60.44. So you're going to spend more on premium than you save in coverage for medical care. I'm not saying don't choose the plan, but don't expect to save money with the plan. People who choose the UC High Option plan their priority is to not have to keep track of medical bills. Their priority is to pay zero for medical care, even if they don't save money per month. And if you take a lot of prescription drugs, not expensive drugs, because if you take a lot of expensive drugs, you're not going to spend much on prescription drug copayments through our Medicare PPO plans anyway, just because of the way Medicare Part D takes into account what the plan spends on drugs as well as your copayments. But if you take lots of drugs that aren't expensive, this plan, you could hit the $1,000 out-of-pocket maximum for prescription drugs. But will you really be saving money over the UC Medicare PPO plan? It is unlikely. Choose this plan for convenience. Again, other limitations that are similar to the UC Medicare PPO are that the benefits beyond Medicare do not pay for Medicare telemedicine that was taken away starting October 1st. When it comes to diabetic supplies, again, Medicare Part B must be billed first, and you might have to get Navitus involved so that the pharmacy can understand how to bill this to Medicare first, Navitus second. You got to use Medicare providers for non-behavioral health services. There's a 24-visit limit on acupuncture, and you have that same issue with Davis, Sacramento area Sutter primary care physicians not accepting new Medicare patients that I talked about with the Medicare PPO. Next up, our final Medicare PPO plan. Now let's talk about the UC Medicare Choice Plan, a Medicare Advantage PPO plan through United Healthcare. With UC Medicare Choice, not to be confused with UC Medicare PPO, right? With the Choice Plan through United Healthcare, you must sign over your Medicare benefits to United Healthcare. Medicare then pays United Healthcare to take care of you, something like $1,000 a month. And then you use United Healthcare as if Medicare doesn't exist. Now, United Healthcare, they don't limit you to their own preferred providers. I know it's a PPO plan. It may not be intuitive, but they'll let you go to any Medicare provider. You don't have to use United Healthcare providers. Now, not all Medicare providers will take a Medicare Advantage plan like this. A lot of doctors won't take Medicare Advantage plans because of the prior authorization hassles. And I just had a retired professor, email me. He is furious because his hip replacement was just canceled by United Healthcare. They wouldn't approve it, even though his doctors consider it medically necessary and tell him he would have had that surgery if he had Medicare as his primary insurance. But that's how United Healthcare can try to keep the money that Medicare pays them and that you and UC pay them, is they're trying to limit coverage to only the absolutely necessary services. Now, although not all Medicare providers will take Medicare Advantage plans, 90% of U.S. physicians contract with United Healthcare. So you probably have access to something like 90% of U.S. physicians and probably all hospitals. Now, remember that this is the partner plan to the UC Blue and Gold HMO through HealthNet. So if you and any family members are in a mixed Medicare situation where some of you have Medicare and some of you don't, some of you might have this plan, UC Medicare Choice through United Healthcare, while the non-Medicare family members have HealthNet, the Blue and Gold HMO. Likewise, if you're going to turn 65 sometime soon, call us 3 months before you do so, and Nick Robledo and I, we will help you in to the UC Medicare Choice Plan, which is a nice upgrade from HealthNet. Coverage through the UC Medicare Choice Plan is with flat dollar copayments, very similar to HMO style copayments, even though this is not an HMO. Physician office visits are $30. Virtual visits through Amwell, Doctor on Demand, or Teladoc are $0, $20 for behavioral health. Emergency room copayment is going up next year from $65 to $100. Outpatient surgery is $100. The inpatient hospital copay is going up from $250 this year to $350 next year, similar to Kaiser Senior Advantage. And there's a new copay for Medicare Part B, as in boy, drugs. Now, I don't want to give you a headache, but Medicare Part D, as in drugs, pays for outpatient prescription drugs. But there are certain drugs that you get in a doctor's office that Medicare Part B, as in boy, might cover. With this plan, you'll have a $30 copay for those drugs that you get in a doctor's office. Okay? Now, the medical out-of-pocket maximum for this plan is $1,500, similar to the UC Medicare PPO. But you'll very likely pay more for medical care with these copayments than you would through many services through UC Medicare PPO. People who have the UC Medicare PPO Medicare Supplement plan, they tell me that it amuses them to pay their medical bills because they go to the doctor and then 2 or 3 months later they get a bill for $3.23 or $11. One person with that plan told me that they had a $170,000 surgery. Their out-of-pocket was less than $300. So it is very possible that you would spend more on copayments for care through this plan than you would coinsurance of 4% under the UC Medicare PPO. Just something to think about as you consider these copayments, but both plans have the same $1,500 out-of-pocket maximum. When it comes to mental health benefits through the UC Medicare Choice Plan, you can use Medicare or non-Medicare providers. Either way, you're going to pay flat dollar copays similar to the medical copays under this plan. It's $30 for office visits, $250 this year for inpatient hospital copays, going up to $350 in 2026, similar to the Kaiser Senior Advantage coverage. Something that's relatively new with this plan is that state licensed marriage and family therapists and MFCCs, they can bill United Healthcare. In previous years, they were not able to bill United Healthcare, so this is somewhat of a change as of last year. When it comes to the prescription drug benefit under UC Medicare Choice, the pharmacy benefit manager is OptumRx, and there are going to be some changes to the drug coverage for next year. First of all, right now there's a 3-tier pharmacy benefit structure, pharmacy copayment structure. Next year, that's going to be a 4-tier pharmacy copayment structure. They are adding a new specialty prescription drug tier where you're going to pay 30% up to $150 a month that you didn't have to pay this year. So be aware of that. On top of that, there's a new Part D $100 deductible for drugs that you get through tiers 3 or 4. So if you get non-formulary drugs authorized by your doctor, your doctor obtains prior authorization from OptumRx, you're going to pay a $45 copay after you've met a $100 deductible. Same for those specialty medications where you pay up to $150 a month. For the tier 3 and tier 4 drugs, you're paying first a $100 deductible and then the cost share beyond that. So that's all new for next year. Heads up. To get 90-day supplies for 2 copayments, The only way to do that with this plan is through mail order. And you can use mail order through UC Davis Pharmacy Mail Order, which is relatively new, or OptumRx Home Delivery, which is United Healthcare's own mail order pharmacy benefit. Now, some medications will require prior authorization, same as all the other plans. Yes, there can be select generics that you pay nothing for, but there is a separate prescription drug out-of-pocket maximum of $2,100. Now, that's the same out-of-pocket maximum as Kaiser Senior Advantage and UC Medicare PPO. And again, if you take expensive drugs, you'll pay your copays, but if OptumRx is spending a lot more on drugs than you are, you may never hit this $2,100 out-of-pocket maximum. Even if you take specialty medication and you pay these deductibles and these higher coinsurance benefits, you may not still hit the $2,100 because remember, under the Part D rules, they're taking into account what the plan spends on drugs as well as your cost share. So that should help protect you. Now, UC Medicare Choice has some special benefits beyond Medicare, some extras that some of the other plans don't have, especially compared to the other Medicare PPO plans. For example, if you have UC Medicare Choice, you will be able to work out for free at certain fitness clubs. Now, you may remember that over time, this plan has seesawed back and forth between Renew Active and Silver Sneakers and Renew Active and Silver Sneakers. Well, we're back to Renew Active in 2026. And the reason for that is that a lot of people complained that Silver Sneakers did not offer as many gyms as Renew Active did. So I'm hopeful that there will be a gym near you. But honestly, I have not looked to see where the Renew Active gyms are. Something that's very unique with this plan, post-hospital discharge, meals and transportation would be covered. If you are discharged from the hospital, you'll have some coverage for some length of time. I can't quite remember how long, but you would get essentially TV dinners provided by United Healthcare for a little while when you get out of the hospital, which might be handy when you've just gotten out of the hospital. Now, UC Medicare Choice used to include a personal emergency response system where you could wear a bracelet or a necklace where you could press a button and summon help if you've fallen and can't get up, that kind of thing. That benefit through Lifeline is being discontinued for 2026, I'm sorry to say. Medicare doesn't cover hearing aids, but we've added hearing aid coverage. The hearing aid coverage with this plan does have the $2,000 limit on it that the other Medicare PPO plans do not. But like the other Medicare PPO plans, this plan does have that coverage, comprehensive coverage outside the United States for up to 6 months if you need it. Now, United Healthcare does not have a network of preferred providers outside the United States. You will be paying up front for most medical care. Now, if it's something really expensive, don't get me wrong, you can try to get the hospital, United Healthcare to reach out to the hospital so that you don't have to front $30,000 for a heart procedure or something like that. But in general, you're going to pay up front and submit claims for reimbursement to United Healthcare. Now, just like the Medicare PPOs through Anthem, we've added the coverage for non-Medicare mental health providers. But if you didn't notice it on the behavioral health slide, you won't be balance billed here. According to what we've been told by United Healthcare, they'll pay your balance billing, which is interesting. So the UC Medicare Choice Plan has several nice things about it. Like you can go to any Medicare provider who will bill United Healthcare. You're not limited to United Healthcare PPO providers, even though it's a PPO. You can use any licensed provider for behavioral health. You have comprehensive worldwide coverage for up to 6 months, like the other Medicare PPOs. But this plan offers some unique benefits beyond Medicare that the other plans don't. And Sutter primary care physicians in the Davis-Sacramento area, some of them are accepting new Medicare Advantage patients because, as I've been told, it's too difficult to shut it off with United Healthcare. Something interesting that is not true for the other Medicare PPOs, foot orthotics. With Medicare, you have to have a diagnosis of diabetes. in order for Medicare to cover foot orthotics. Not so for this plan. United Healthcare will pay for foot orthotics even if you don't have a diagnosis of diabetes. So again, this plan has some unique features that the other plans do not. Now, this plan does have its limitations. For example, some doctors will just not take Medicare Advantage plans because of the prior authorization hassles. And that's really, in my experience, not any major health systems in the Davis-Sacramento area, but I have come across some smaller specialty practices that will not take this plan in the Sacramento area. Prior authorization is required for many services. Prior authorization that Medicare itself would not require. But because you've given your Medicare benefits to United Healthcare with this plan, they are free to require prior authorization of your doctors. And I've had a lot of complaints about, well, I can't say a lot. I've had more complaints about prior authorization with this plan than in previous years lately. Now, we have a weird problem with this plan that I'm going to try to explain to you here. If you happen to use a medical office building that is owned by a hospital, it may result in United Healthcare applying a $100 copayment to something that would otherwise be a simple office visit. So instead of paying $30, you're paying $100. Now, this could happen anywhere a medical office building is owned by a hospital, but where it happens most often in the Davis-Sacramento area is at the UC Davis Ellison building and the UC Davis Glass Rock building. I've had this come up several times. We have not been able to solve the problem. Just trust me, pay the $100 copayment and move on with your life if you have this plan. There's no point in appealing it. Here's what happens. If you use a medical office building like the Ellison or Glass Rock buildings that are owned by the hospital across the street, the hospital has to charge facility fees. And United Healthcare will get then two claims, one for facility fees and one for doctor fees, physician fees, professional fees. When United Healthcare gets facility and professional fees, because so many procedure codes are surgical, even though they are not surgery necessarily, because so many procedure codes are surgical, every once in a while, they'll apply a $100 copayment. For example, I've had one person go to the Ellison building, and they went there to get their cast sawn off after their broken arm healed. They were charged $100. More commonly, it's people who go to Glass Rock. They see an ENT doctor. If that ENT doctor pulls out any earwax, you might have a $100 copay. Again, I'm warning you about this so that you can understand it and it will not enrage you. Just pay the copayment and move on. It's a known issue with the plan. Remember, you still have a $1,500 out-of-pocket maximum for the year. So even if you went to the Glass Rock building for earwax a bunch of times, you're not going to pay more than $1,500 a year plus copays for drugs. Other limitations. You must use Medicare providers for non-behavioral health services, which is typical for the Medicare PPOs. You have to pay up front and apply for reimbursement for non-Medicare mental health services through this plan other than MFTs and MFCCs, which is a little different. The hearing aid plan is limited to $2,000 every 36 months, whereas the other Medicare PPOs don't have that limitation. And you have a 24-visit annual limit on acupuncture and chiropractic, which, by the way, are $30 for acupuncture and $20 copayments for chiropractic. Well, that was the last medical plan that we're going to talk about. Now, I want to talk about vaccines for anybody in any of the Medicare PPO plans. And the reason this comes up is that Medicare Part B as in boy pays for the administration of vaccines, whereas Medicare Part D as in drugs pays for outpatient drugs like the vaccines themselves. So we have this inherent conflict created by Congress, if you will, with Medicare Parts B and Part D, and it makes things confusing and difficult. So if you're in a Medicare PPO, here's my advice for you. If you're going to get a shingles vaccination, do not get it at a doctor's office. Use your network pharmacy. In my experience, if you get it at a pharmacy, you won't pay for it. If you get it at a doctor's office, you will. When it comes to flu shots, I've seen it work at either doctor's offices or network pharmacies. But just in general, network pharmacies seem to be a little easier when it comes to vaccines. But because it varies between plans and vaccines so much, I'm just going to say it this way. For everything else, check with your plan before you get a vaccination so that you don't end up having to pay up front for care and submitting a claim for reimbursement later. That's more work than you should have to do. So in general, when it comes to vaccines, I would say stick to your pharmacy if you can, except for flu shots. And if you really want to get an immunization at a doctor's office, you really need to check with your plan to see how they're going to cover it. I hope that keeps you out of trouble. And next, the thrilling conclusion of the UC Retiree Medical Plans presentation for 2026. When you're choosing a plan, I want you to think about some things. First of all, know that every plan has a different drug formulary. So you may not want to pick the plan that you choose solely based upon coverage for your favorite drug. Well, maybe not your favorite drug, but a drug that is important to you, okay? Because especially with Medicare Part D, these drug formularies can change quarterly, I believe. You want to match your priorities with the services that are available. Is your priority to not spend money on healthcare? If that's the case and you don't have Medicare, you might want to be focusing on the HMOs. Is your priority access to services, access to providers? If so, you may want to focus on a PPO plan. But that's just a general way to look at it. You'll probably want to do a cost-benefit analysis based upon the premiums that you'd have to pay, whether you're sick or not, and your expected medical, mental health, and pharmacy needs. When you're thinking about these things, you got to take into account everything. Don't forget to include the medical, mental health, and pharmacy costs that you might incur. Think about those things. Review the plan booklets. Remember, I've tried to explain the plans as I understand them to you, but to really see the details about what's covered, what's not covered, how to file appeals, how to use the plan most efficiently, you're going to want to review those evidence of coverage or summary plan description documents. Those plan booklets are available on the Open Enrollment website or the UC Davis Healthcare Facilitator Program site. If you click on the link in the menu that says the fine print, where to find health insurance coverage details. Remember that if you are going to make a change for open enrollment, enrollment is open until 5 p.m. on the Friday before Turkey Day. That's Friday, November 21st. If you can't make the change online yourself using UC Raise, you can call the RASC and have them make a change. You can request forms if you need them. But if you are making a change via UC Raise, again, get that confirmation number. Check your UC Raise messages. If there's no confirmation in there, you did not successfully make an open enrollment change. And don't forget that if you or a family member has Medicare, you'll likely have an additional form that you'll need to submit by November 29th that you attach a copy of your Medicare card to. But also remember that you can always change plans again during the next open enrollment. Nick Robledo and I are here to help. If you have follow-up questions, give us a call. The best way to ask us questions is by phone. Due to the complexities of healthcare coverage, it's really hard to answer a lot of questions by email. Not that you can't email us, but if you do, please include your phone number. Now, for detailed contact information for the two of us, you want to take a look at the Healthcare Facilitator Program flyer, which is on the Contact Your Healthcare Facilitator page of, it's in the menu on the UC Davis Healthcare Facilitator Program website. Contact Your Healthcare Facilitator. You'll find a link to this document as well as a link to the backside of this document that I'll show you on the next slide. On the UC Davis Healthcare Facilitator Program website, under Contact Your Healthcare Facilitator, you'll find this document, which is kind of a map that helps you decide when you need to call what entity as it relates to health benefits. I call it the whom to call chart. So it breaks it out into employees and retirees, and retirees. So if you're a retiree, it talks about how if you have questions about your pension, tax withholding, or tax statement, or you've locked yourself out of UC Rays, you need to call the RASC. But if you have questions about health coverage, you can call the Healthcare Facilitator program. So there's that kind of advice about where you would go for different questions on this whom to call document. Remember that when you call the RASC, you're not speaking to people who specialize in health coverage, but you are speaking to people who specialize in pension and tax withholding, and they can get you your tax statements, and they can get you into UC Rays when you've locked yourself out. But if you have questions about health coverage and Medicare enrollment and Medicare coordination, I would encourage you to call Nick or me, because that's our specialty, and we're local and we're here to help. That concludes UC Retiree Medical Plans for 2026. I hope you feel better prepared for this open enrollment where we have premiums going up and down all over the place. We have plans being eliminated, new plans coming into place, co-payments going up. There's a lot going on during this open enrollment, so I hope you feel like you understand it better by reviewing this video. If you have follow-up questions, please give me a call. Call me when you need me. May you never reach your out-of-pocket maximum.